Right. Well, the therapeutic order is one of the founding concepts of naturopathic medicine, and it's taught in our naturopathic theory and practice courses, and it's taught throughout our ology courses, so that students are always looking at how to frame a case and manage a patient through this therapeutic order lens. And if you imagine it as a giant pyramid, the base of the pyramid is the foundations for health. And that's what we look at, evaluate, and try to address first. Restore the basic building blocks of health. These are the really fundamental aspects, like sleep, like diet, like hydration, like stress management, like attending to mental, emotional, spiritual pieces of the person's life and community. Moving up from that, as the pyramid moves up and builds, would be addressing tonifying systems, so organ systems, looking at liver function and how this might be impacting whatever is going on. In this case, it would be PCOS. Looking at the kidneys, looking at the lungs, looking at the heart, looking at the skin, looking at the organs of elimination like the intestines. Next up the therapeutic order would be addressing structural issues. This is not so much an issue with PCOS, but many conditions are impacted by musculoskeletal and nervous system function. Moving again up would be the use of natural substances. These would be things like nutritional supplements, plant medicines, and other types of agents such as that. Moving up the order more would be the use of synthetic substances. These would be either synthetic nutritional supplements or conventional pharmaceutical drugs, either prescription or over the counter. And finally, at the highest level of the therapeutic order would be surgical intervention, which again in this condition not typically an issue, but in other conditions such as breast cancer and other oncology patients, your area of specialty, surgery is a very, very appropriate use of the therapeutic order. So the concept is use the least invasive and most the bottom levels of the therapeutic order first, and as much as possible, and move up that ladder or therapeutic order only as necessary.
Okay.